Well, hello, this is Fixer Upper Fitness. Today, we're going to talk to you a little bit about your immune system and how that is affected by current conditions and the environment you're in, as well as physical activity and your nutrition. So I have with me today Gwyneth Bradshaw. She's going to wave at you from socially distant, acceptable. Here we go. She's going to pop in when we talk a little bit about nutrition as it relates to our immune system. So we really want to see in the time we're in with this whole COVID-19 situation going on and our attempts to avoid being infected by that virus and how we're doing all the right things, we're staying at home when we need to, or only going out when we need to. We are, wearing our masks when we're out, gloves. We are staying distant from one another. And I want to talk to you a little bit about how this may impact our immune systems and what we can do from a standpoint of correcting some of that with exercise and nutrition. So when we look at our immune system, the immune system is not just one single entity within our body. It's a conglomeration of many different cells and chemical and mechanical kind of systems in our body that try to protect us from sort of invading things that could harm our body. It also helps us heal when we've been injured and things of that nature. So one of the subset systems is our mechanical type of things, whether it's our skin blocks a lot of things that could infect us from getting into our bodies. And we have a lot of mucous membrane systems in our nose and throat that capture things as we breathe or as we swallow or as things try to get in. They'll be captured in these mucous membranes and kept from harming us. We also have sort of chemical barriers as well. The pH level in our stomach destroys a lot of things that would invade us that we eat. We have different types of like lymphocytes that attack the cell walls of invading viral cells and things of that nature. And we have some cellular defenses as well. Natural T cells that attack those invading cells directly. And we have B lymphocytes that create antibodies that attach to these cells and make them easier to find and destroy by our body. So the components of the immune system are many and varied. So what damages our immune system? Social isolation and confinement do. So the situation we're finding ourselves in to protect ourselves from a virus in some ways is making us more vulnerable to that. When you look at our being away from one another and not being able to trade different germs and things and being able to make their cells stronger. But confinement can also mean that we are not sleeping well. We're under a lot of stress, a lot of fear about the future, about getting COVID, about what is happening to our businesses, what is happening in the world. So when those things begin to happen, sometimes we don't eat like we should. We let our diet go. Body's not getting the nutrition that it needs. And we also tend to watch Netflix. So we're not doing the things that we should from an exercise standpoint, activity standpoint. You might be very active at your work, but you've been furloughed or you're working from home. So you just don't get that same level of activity. So all those things will create in us a lower, less effective immune system. Well, we can only improve what we can control. We really can't do a lot about the quarantine, and we can't do a lot about activating our jobs or our workplaces or returning to normal as yet, although I think that's what will happen. We can't control that. It's not fully within our control. But the things that we can control perhaps are sleep. We can get ourselves on a schedule where we're getting the right amount of sleep so their bodies have the energy to do what they need to do. we can work on our diets. And Gwenny will come talk to you about that in a few minutes. And then we can control our lack of physical activity and set aside time in our day to develop an exercise program that will help us. So, according to the American College of Sports Medicine and in their guidelines, exercise does a lot of things. There are a lot of independent studies, scientific studies, that show that exercise allows us to improve our response to chronic inflammation, vaccinations. It improves markers in various diseases like HIV, cancer, cardiovascular disease, diabetes, obesity, as well as cognitive impairment. So there's a lot of evidence and studies that back up the fact that not only does exercise help markers in these various diseases, but they also help in strengthening our immune system. So according to the American College of Sports Medicine, the level of exercise we should be getting, it's sort of based on the intensity of exercise that you would engage in. Vigorous activity means 60 to 85% of your max heart rate should be kind of a rule of thumb to where you should be for vigorous exercise. If you are looking at a moderate intensity, then you'll need to be about 40 to 60% of your max heart rate or heart rate reserve to get an immune boosting effect. So when we look at heart rate and heart rate reserve, you would take your max heart rate, and the rule of thumb there is 220 minus your current age. So if you're 60 years old, your max heart rate should be around 160. If you know your resting heart rate, you can deduct from that. So if you have 160 and your resting heart rate is 60, you would take your 100. So for vigorous, you would want 60% of that. So 60, add back your resting heart rate. So about 110 to 120 heart rate is where you should be for vigorous. Vigorous intensity, obviously your heart rate will be higher, and you want to get about 75 minutes a week of that, and that can be broken up into 5 days of 15 to 20 minute bouts, and that would be perfect to help you boost your immune system. The same for moderate. You'd find your max heart rate, subtract your resting heart rate, take that number, take about half of that, and then add back your resting heart rate. And for that, it's going to be a lower number, in the 90 to 100 range, depending on your age. So if you get 150 minutes of that a week, you break that up into 5 sessions of 30 minutes each. That's perfect on a weekly basis to help boost your immune system. And that could be walking, jogging, getting on a bike. It could be a resistance weight routine that lasts that long. But whatever you prefer, whatever you want to do, be sure to set aside time to be able to do that. So when we look at, in conclusion, if you look at exercise as a component of boosting your immune system, so what is it going to do? What is it going to do for you? If you boost your immune system, you're going to feel better, get outside, get in the sun, and do all these things. It's going to help you in a way to limit your exposure. It's going to make you less likely to get the virus or get a harmful sickness. It's going to sort of minimize the deleterious effects of the sickness, ameliorate the symptoms, make them less bad, make the suffering a little bit less when you're under that virus. It's also going to speed your recovery and lessen the likelihood of infecting others. So when you combine that all together, it's very much worthwhile to set aside the time to exercise. Now I'd like to move 6 feet away and allow Gwyneth to come in and do her talk about nutrition as a part of boosting your immune system. Thanks.
Hello. Thank you, Sir Mr. Morgan, aka Dad, for walking us through kind of the overview of the immune response and how exercise plays a role. I want to talk about a little bit just how nutrition can play a role as well. The number one and most important thing that I kind of always stress first is just having a well balanced diet. So, making sure that you're getting enough protein, enough carbohydrates, enough fat in your diet, those big macronutrients before you dive down and focus on the micronutrients. So, undernutrition or malnutrition can really impair your immune response. So, make sure that you're getting enough calories, in your day. We're not starving ourselves to meet goals or things like that, because then we're more likely to get sick and we won't have the tools our body needs to fight disease. So I kind of want to focus on four main micronutrients today. The first one is a mineral, which is zinc, and you don't hear about zinc a lot unless you're talking about the immune response. Um, Zinc with vitamin A together, they help cell division happen, and so when you're struck with a disease or a virus or something that's injuring your body, cell division is really important. You want to take those antibodies and the T cells and the B cells, all those, and you want them to multiply as fast as possible. And so zinc and vitamin A together are really important for that. The other two micronutrients are vitamin C and vitamin E. And those two are antioxidants. And so they take some of the inflammation that's occurring in your body because of your immune response. I want to sidebar for a second. A lot of people think that inflammation is a bad word, that you want to avoid it at all costs. But when it comes to immunity, it's actually really important to have inflammation, because that's your first line of preventing disease and beating a virus. Like if you injure a body part, if you cut your finger or something, you want inflammation to happen right there, because that's how it heals. What we don't want, though, is that chronic inflammation. So back to antioxidants, vitamin C and vitamin E, they help destroy some of the reactive particles that are left behind in inflammatory responses. And so they take what are called free radicals, which are really reactive, that cause a lot of negative reactions in your body. They take those and they get rid of them. And so that's why we want things that have vitamin C and vitamin E. Make sure we're not getting any questions. Perfect. So I'll talk about kind of the sources of those minerals, just in case you're not getting them in your diet. I'm not a big fan of supplementation unless you really need it. So if you feel like when I go through these food items, if you don't eat any of them, then maybe you should take a multivitamin, or make sure you're getting kind of some of these minerals on the regular through that. So vitamin A is found in eggs, it's found in your orange and yellow vegetables. It's also found in a lot of fish, fatty fish like salmon, and cheeses as well. It's a nice fat soluble vitamin, so it's in a lot of fatty foods. Vitamin E is found in your nuts and vegetable oils, in like sunflower seeds and other seeds like that. It's also found in avocado and spinach. Vitamin C, you probably think of oranges when you think of vitamin C, but it's also found in like broccoli and Brussels sprouts, leafy greens, and sweet and regular potatoes. So if you aren't a big citrus fan, then you can aim for that. And then vitamin E, and then zinc is the last one. Zinc is kind of a funny one. It's found mostly in meats. So if you're a vegetarian, hopefully you might eat some like dairy or eggs, because it's found in that. But it's also found in seeds and nuts as well. Whoops. Carrots. Yep. So there's a lot of vitamins and minerals, and they're all important in your body. But the main ones for immunity, at least, are vitamin A, zinc, vitamin E, and vitamin C, as well as just maintaining that well-balanced diet. If you have any questions, please just ask them in the comments below, and we'll definitely get back to you and answer them the best we can. Thank you, Mr. Morgan, Hazel, Dad, for walking us through the beginning, and thanks for tuning into our video. Just let us know if you have any questions in the comments, and have a great Memorial Day weekend. We'll see ya. I'm trying to hit end. Okay. End.